Hello everyone, my name is Lade. Welcome to Love My Baby Journey. Today we'll be discussing mental health in pregnancy and post-birth. And to discuss this topic with me, I have invited a mental health expert. She goes by the name Tammy. Tammy, can you please introduce yourself?
Hi everyone, my name is Tammy Lola Joseph, and I'm a mom of 3.
Yeah.
I've been working in the mental health field now for close to 8 years, if I'm not mistaken. And yeah, that's it.
Yeah. And you have a dance health wellness page.
Oh yeah.
Yeah.
On Instagram.
Welcome, Tammy. Thank you for joining us today. So let's get right into the topic. Sorry, there's an assumption that, in pregnancy and as a new mom, everything has to be happy, exciting, you should be on a jolly ride and over the moon. Definitely pregnancy and being a new mom is exciting, but we know half of pregnancy, some women will struggle all the way through. There's so many things going on, hormonal change. There's just so many things that can negatively impact the mental health of women in this period. So as a mental health nurse, what are the mental illness you see women present with, and how common are these illnesses?
With my experience, mostly women with pregnancy and with babies present with depression, number one.
Yeah.
And mostly anxiety and depression. Those are the 2 major illness that they usually present with in the hospital. And I'll say 1 in 5 women experience this kind of mental disorder.
Yeah.
And after birth, most women present with postnatal depression. So that's classified as postnatal depression, which means after they've had the baby, that's when the mental illness start to kind of occur.
Yeah. So do you think that this condition can be well managed in the community, or is it even preventable at all? I know because on the ward it means it's high acuity and they actually have to be there. But can it be managed or well controlled in the community? And is it possible that women can actually prevent this condition?
Yes, this is very possible to prevent this sort of occurring from you. This, boils down to you looking after yourself from the onset of, your pregnancy or your childbirth journey and all that. So it can be preventable when you're aware of yourself, you're aware of your mental health, you've been taking care of yourself. And of course, even if you've been
taking care of your mental health, not just, physical self.
Yeah. Yourself. Yeah. Like holistic approach to your health.
Yeah.
So with, talk of preventing it really, some women have underlying mental health that kind of, surface when they're going through all this stress and changes in their life. And, in some way you can prevent it. And in another way, I say you can't really prevent it.
So it can be prevented, but, you also said most women do not have control over, this illness. So maybe, then they end up on your ward. What is the kind of care or support that they can expect while they're on the ward?
With the mother or pregnant women.
Pregnant women and new moms.
New mom, they expect to be given information, number one, about mental health, to gain some education about what's going on with them and with their body, and also to gain support regarding medication, support that might be out there in the community, especially when you first presented. You might be wondering, is there any support for me out there? So we it's in the world that you can get referred to services that might be appropriate for you. Mm-hmm. You can get linked up, especially your family, maybe a family that might be looking after you. You can get linked up with some support out there, and when a mother comes with baby, we help them understand that this is a new change, in their life, and a lot of people go through it. We kind of normalize, help them to normalize this kind of condition that they're going through, and that kind of sort of help them to, recover and relate with it rather than them dealing with it alone. Do you understand? And also on the ward, you expect to have psychiatric support and all the holistic support in terms of with baby as well. We help you to look after your baby,
give them a break,
and and give you a lot of information.
Thank you for sharing. That's good to know. That women shouldn't be afraid to, or families shouldn't be afraid to send their partners in, or their daughters in. So I just want to talk about partners. So there's a lot of portrayal out there on social media about, pregnancy, beautiful pregnancies and, flat belly, skinny women, after one day post-birth, like the belly is already flat, and that's kind of their expectation. So when they see other than what they think is normal, I think they put unnecessary pressure on someone that is already struggling. What advice do you have for partners? How can they become supportive rather than judgmental in this fragile period?
Look, social media has definitely made things to escalate to the point of, partners might not even know they're doing this intentionally. It might not be their intention, but subconsciously, one way or the other, they're putting pressure on their women because of what they see. So my advice number one is don't compare your women's experience with another. Don't compare with maybe your mother or your sisters. At that time, usually most women are at the most vulnerable time of their life. So all they need at that time is your support, your care. Tell them you love them, not just even telling them, showing them you care. And genuinely care, you know what I mean? Help around the house, little things. Show her how much you care by telling her how beautiful she is. Because most women at this stage, they're experiencing body image issue. They're experiencing changes in their body that they don't even understand. And, they're having all these insecurities about themselves already. Plus having to care for a baby. So partners, this is the time to show your partner support, to show your wife you care, help around with house chores, help to look after the baby, take turns to look after the baby, let her sleep. This is the time to show how much you really, really care. Because I tell you what, she's gonna really appreciate you for it. After she's all, glammed up and stronger again, she will look back and say, wow, you were really there for me. I'm pretty sure every woman look forward to that kind of day.
Thank you so much for sharing this. Be supportive. That's what Tammy is asking.
It's very important.
Yes. Thank you so much. So I go on to, when women are struggling, they will display some signs that they're not coping. What are these things that they might do, or they might maybe do, that you can tell that they're not coping?
Usually, number one, with women, there are lots of hormonal changes that happen during pregnancy and, after birth. So they might have mood swing. They might be a lot more irritable than usual. The things that usually won't irritate them, you would just do something little and they will, escalate it. They might be even teary at times, always sad, very grumpy, things that that they usually enjoy, they no longer having interest in that kind of thing. Maybe they love to enjoy movie, they love to dress up. You just see that they're no longer looking after themselves, they no longer care about how they look, or they're getting very really snappy, and they just sad, and they're anxious. Some might even verbalize their anxiety and insecurity and kind of pour it out on you, or frustrated about life, All those kind of little things are the things that, a partner can pick up in a mother that might be going through some stuff, because emotional health is not something you see on the surface.
Yes.
It's at the end of the day, it's how the person reacts. So these are the things that you can pick up as a partner.
Okay, thank you. So once they've picked up on this, anxiety or irritability and all, what should be the next step they should take? I know, confronting someone that is already irritable can, escalate into things, into a big fight, and you're trying to avoid it. How can they gently, nudge their partner to say, this is not you? How can they say that? How can they, and then after, getting that awareness from her, what else can they do from there?
Look, if the person is not at the point of crisis, they're still, out there and well enough to you think they can still make decisions, look, approach them with love, not in a kind of attacking way, but just, my dear, I just noticed, lately you've been like this. Is there anything I can do to help you feel better? I know this can be a lot of, heavy load on you. Yes. And, I'm also learning as well. Let them know that you're also, learning through the process, and it's a huge responsibility having a baby. Yeah. So let them know that you're there. Let me know what's going on. Talk, communicate with her. Yeah. And, if you see that there are no changes, encourage her to see a GP. They call it general practitioner, a doctor. Yeah. Do you want to see a doctor? Do you want to speak to someone? Are you okay? Just asking, are you okay? And if they agree, you can take them to the GP. Yeah. You can take them seek professional help. Okay. If it's something beyond your control. And if to say they're having like a crisis moment, breaking down, getting angry, and they kind of at risk to themselves and the baby, or they're expressing a kind of, feeling low in life, feeling suicidal. At some point, some women can even feel suicidal. If you pick up all these things, especially when it comes to suicidality, you have to take them to the hospital. I wanted to say, take them to the hospital, or you call 000, and it's actually an emergency when it gets to that stage. So know when your woman is still kind of, up there, able to make a decision, still herself, and when they're having a crisis.
Yeah. Okay. Thank you so much. So I want to talk about mental health and African ethnicity. Most of us, I don't know if you would agree with me, but most of us grew up not to disclose so many things, especially mental health. Like, you're encouraged not to go, see your doctor if you're expressing any signs of, anxiety or depression. They just think, oh, you're strong, you should just get over it. First of all, Tammy, what do you think about this culture? And, what would you advise an African woman, or even people from, different backgrounds, experiencing the same thing? What would you advise them to do in this situation?
The COVID period and the lockdown period are sort of, open a lot of people's eyes to the possibility of almost everyone having a mental health issues. So in this kind of situation, if you see that somebody is coming up with, this problem, don't cover it up. It's kind of a very, very toxic behavior and toxic culture to say, oh, I'm strong. And I can relate it to my own experience. You have a spiritual background. You think, oh, my faith can, heal me. A lot of people think like that. They think, oh, Africans don't have mental health. That's toxic. Wrong. Don't do that. That's very, very wrong. Yes. Mental health can happen to anyone. Yeah. You know what I mean? So don't bottle it up, especially if it's you or any of your family member experiencing this. Don't bottle it up, because the longer you let it linger, it just becomes more and more problem that at the end of the day, it becomes resistant to treatment, if that makes sense. Yeah. So it's better you seek professional help on the head. Yeah.
Thank you so
don't
much.
let it linger, please. Yeah.
Thank you
it's
so
very
much.
Toxic.
Baby. I think it's really important that every woman knows that regardless of being African, mental health can affect everyone, anybody. Sometimes you have no control over it. And if you agree with me, Tammy, sometimes it's just a family history that can just go on. And thank you for mentioning faith and spirituality. I think that's how many people cope, especially as Africans. But sometimes you need to pad your faith and spirituality.
Yeah.
You can take it a step further by going to your GP to. Sometimes it's not all about medication. It can just be about talking, having therapies, and that can just make a huge difference, in your mental health. So we move on to the next, and then we're going to talk about you. So I know you're a mom of 3, you're a worker, you have this page, you have these things going on for you. How do you stay organized? How do you stay sane in everything? Can you share tips for moms struggling out there?
I wouldn't say it's all perfect and rosy.
Yeah.
But number one thing that I think has really helped me is working in the mental health world. So I know from onset it has helped me to be more self-aware.
Yeah.
So I know when I'm doing things out of negative emotion. Maybe I'm doing things, I'm getting irritable, and I know that means I'm tired. Sometimes I just sort of withdraw and speak with my partner and say, I think I need to, sleep. I think I need to rest. It comes to you knowing your body. So I know myself. Yeah. So when I'm beginning to get irritable, get angry, or just maybe cleaning the house, sometimes I'll just be cleaning it grudgingly, and you can tell that the vibe is different. So usually I pick it up first, or sometimes my partner just pick it up. I think
because it recognizes the signs. Yeah,
I think you need to rest, or I ask for help. Please don't underestimate. I know a lot of people think, I don't want to bother anybody. I don't want to burden anybody. You need to have support system in your corner. You need help, especially when you're looking after baby. Talk less of having another 2-3 babies, like 3 kids. You need all the help you can get.
Yes.
Don't say, I don't want to bother them. No, you have to bother them.
You have to
open your mouth.
That's why they're there for you. Your support network. That's why they're there.
Because they can't read your mind. They don't know what you're going through. They don't know you're struggling. So you have to actually seek help.
Yeah.
And knowing when you're at that down moment, you need to come especially for me. I know that sometimes, I love working, and at some point I just thought I need to slow down. That's me. Okay. When I notice that I'm getting, draggy at work, I don't want to wake up. Some days I lack motivation. I know that sometimes I need to just, take some rest.
Yeah.
Or when some days when baby's still fresh, I know that I don't mind leaving the house, dirty. Just to have that
first. Yeah.
Just to have that nap. You have to just drop everything, or even get a cleaner to come to the house. You can get someone to come do house chores.
Yeah.
Go out, speak to your partner. I want to go do my hair today. Even just going to do your nails and do your hair.
Yeah.
Can make a whole difference in your mood.
Yes.
I know we love our kids, we love our baby, we not want to be there for them, but you can't pour out
yourself
empty container. You can't pour out when you're empty.
Yes.
You need to always find ways to fill up yourself.
Okay. Yeah, thank you so much. That's very, very helpful. So prioritize yourself, rest, take a break, ask for help. They're very, very important. So lastly, I know there are a lot of mental health resources out there, but can you list like specific ones for women and accessible ones now that if they need to contact them now, they can?
Beyond Blue,
yes.
Beyond Blue, they have great resources.
Good.
That they can link you up with support services. Just give them a call. There's another lifeline number. I have a lifeline number written here. It's 131114. You can call that number directly and seek advice. And every major hospital, especially here in Australia, they have a triage number.
Yeah.
So you call them, they assess you, they might think, oh, you need to be in hospital. Oh, I'm feeling suicidal today. They will triage you. They will put you in the right place that you need to be. They might say, oh, no, I don't think you need to be in the hospital today. I think you can be treated in the community. They will link you to the right services. So you can go in the ED. You can go to the emergency department.
And they will attend to you as soon as possible.
They will attend to you.
Yeah. Thank you so much, Temi. Thank you for joining today. This brings us to the end of the session.
It's my pleasure.
Thank you so much. Thank you. I want to invite you to like, subscribe, and comment for more content. And till I come your way next time, bye for now.